When seeing the patient, in history it is important to ask the family history of anemia or sickle cell disease. With slit lamp exam, examine closely each component of the eyes. In the fundus exam, pay attention to vascular abnormalities, any scars or hemorrhages, and look for the sunburst and C-fan patterns, and check for retinal detachment. For investigations of sickle cell disease, newborn screening for sickle cell would be an effective way to identify individuals with the disease and to initiate early treatment. This is done by taking a heel prick sample and running an HPLC with it. Hemoglobin electrophoresis can be another investigation from the blood sample, and fluorescein angiogram of the retina to observe any capillary non-perfusion at the hairpin loops is another test to evaluate the severity of sickle cell complications. Let's go through the treatment for sickle cell disease. First, avoiding hypoxia or the cold will be significant to prevent episodes of sickle cell symptoms and complications. Folic acids help make new red blood cells and may help with the oxygen supply of tissues around the body. Hydroxyurea increases the hemoglobin F levels, which interrupts hemoglobin S polymerization in the oxygenized state. It also increases MCV, which is an average size of the red blood cell, and cell hydration as well. Infection control with regular immunization and prophylactic penicillin is another treatment option. Disease-modifying therapy includes chronic transfusion program with iron to flush out and replace the sickle cells with healthy RBCs. Transfusion would be every 3 to 5 weeks with a goal of hemoglobin S being less than 30% of the entire hemoglobin composition. The curative therapy would be to replace the source of hemoglobin S production in the first place, the bone marrow transplant. For fatal complications like vaso-occlusive crisis, pain control and hydration would be unimportant steps to take. And for acute chest syndrome, of course, pain control and hydration. We'll also look into oxygen, pulmonary toilet, infection treatment, and transfusion as well. For sickle cell retinopathy, in cases of active peripheral neovascularization, using scatter laser photocoagulation with 500 micrometer spots to non-perfused retina can be an effective treatment. And intravitreal anti-VEGF can act against neovascularization and provide temporary relief. In cases of tractional retinal detachment or vitreous hemorrhage, retinal surgery is indicated by retinal specialists. Nowadays, with proper care and adequate treatment of sickle cell disease, patients have 95 to 99% survival rate to adulthood. So here's the linking slide again to remind you of the connections between ophthalmology and hematology and how this is strengthened by sickle cell disease presentations. Here is a thorough and helpful flowchart as a summary of everything we've talked about in this presentation. And this is page 1 of the references, all the sources of information we've gathered to put together this presentation. This is page 2. Thank you for watching this video.